You are listening to Hypertension Resistant to Treatment, where you will get knowledge, training, resources, and support for better blood pressure control. If you are suffering with high blood pressure or blood pressure that is difficult to treat, this podcast is indeed for you. Here is your host, Dr. Tanya.
Hi, I'm Dr. Tanya, and I am here to teach you everything you ought to know about hypertension management. I am a clinical scientist, and I've done research over 10 years, and I've found some interesting things about hypertension and blood pressure control and medication taking behavior. I would like to share with you all of the information I've found, as well as all the information that's out there that will help you get control of your blood pressure. Stick with me, and we'll take this journey to help you improve your blood pressure. Thanks for listening. Okay, guys, on today's episode, I want to talk to you about what everybody ought to know about Cenopril. Everybody ought to know the side effects of Cenopril, and they ought to know that there is an alternative medication called Losartan. And Losartan is equally as effective as Cenopril if you're having side effects from Cenopril. Now, if you're African American, you may just want to be on Losartan instead of Cenopril due to the life-threatening angioedema that can occur. Now, if you're having this hacking cough that's really aggravating you, you might want to be on Losartan as well, because Losartan doesn't usually cause those type of side effects like hacking cough and angioedema. Everybody ought to know the side effects of Cenopril, and everybody should know that there is an equally effective medication called Losartan that is not usually associated with angioedema or a hacking cough. Keep in mind that only a small percentage of people have these side effects. And angioedema and an aggravating cough are just two of the side effects that could occur. But they seem to be the most common side effects of ACE inhibitors. Let me step back and tell you what an ACE inhibitor is. ACE inhibitors are also called angiotensin converting enzyme inhibitors. This classification of blood pressure medication is used to lower blood pressure, to protect the kidneys, and to treat heart failure. It does this by relaxing the blood vessels and decreasing blood volume. Cenopril is one of the most common ACE inhibitors that is prescribed. There's also captopril and enalapril and other prils, and that's spelled Pril. Those are medications that end in Pril, pril. They are usually the ACE inhibitors. The patients I've talked with, this hacking cough drives them crazy. They carry some mints so that they can put in their mouths whenever they're at church or whenever they're in a setting that they don't want to have this cough. You don't have to suffer with this hacking cough, even though it's not life-threatening. This is bringing down the quality of your life. Every time you have to worry about this hacking cough or you're worrying about being in a meeting and coughing at the wrong time. So I would encourage you to talk with your healthcare provider. There's a safe and effective alternative for this. I really want to get to the life-threatening side effect of Cenopril. And that life-threatening side effect is what we call angioedema. Some people have slight symptoms at first. They may start with just a numbness on their tongue, or feeling a numbness on their lip, or they may get an itchy throat, or just like an itchy feeling in their mouth or tongue. And over time, this feeling gets worse or more prominent. I've seen patients come in with just a swelling just a slight swollen lip that they just thought was due to some other problem. Don't ever hesitate to call 911 if somebody's having trouble breathing for any reason, or if you are having any trouble breathing for any reason. But if you are African American, talk with your doctor to see if losartan is right for you. I know I sound like a commercial, but this is very important. For years, some patients have been on Cenopril and then end up having this angioedema or allergic reaction. So an EpiPen is just epinephrine that's in a device that you can inject into your leg or arm in the event of a life-threatening allergic reaction. So if you and your doctor decide that Cenopril is better than losartan for you, at least keep an EpiPen handy, just in case you experience this angioedema, because it is no joke. I have a brother-in-law that this has happened to his father. It's just a sad story that I heard at our Thanksgiving dinner this last year, that his father died because of this angioedema that occurred. And I was just very saddened by this. And that's why I really want to make sure everybody knows about this, Cenopril, that Cenopril has the potential to cause angioedema, especially for African Americans. So I really want everybody to consider losartan instead of Cenopril in order to prevent this type of life-threatening event. And I would like for everybody to get an EpiPen if they are on Cenopril. EpiPens are very expensive. Some insurances cover EpiPen. I know just several months ago, EpiPen was in the news about how expensive it is, but when you consider the fact that this could be a life or death situation, it really doesn't matter how much it costs. I suggest that you go ahead and at least have an EpiPen available just in case, and let your family members know about this EpiPen and how to give it to you just in case you're not able to give it to yourself. And I would also encourage you to go over to my website, hypertensionresistanttotreatment.com, and click on that video that's from YouTube that's going to show you how to give an EpiPen and give you some more information about an EpiPen, how to administer it, and how to store an EpiPen. And now you know what everybody ought to know about Cenopril. I want you to talk with your healthcare provider if you're on the Cenopril or an ACE inhibitor. Consider a safer alternative, which is losartan. Stay tuned for Hypertension Resistant to Treatment for our next episode, when I'll have an emergency room doctor on to tell us all about what goes on once you go to the emergency room for hypertension treatment. Thanks for listening.